Yes, you can ask for whatever you want when you do an IVF. But another thing is if we do recommend having twins. It's true that sometimes for the patients it's a good deal if you just go through one IVF and you have your two babies and you can close this door and start a different life, forgetting about the fertility issues. But as I like to say very often, what we are looking for is not for eggs. We're not looking neither for embryos. We are looking for healthy babies. And the easiest way of having a healthy baby is having a single pregnancy. So though sometimes twins may look as a good option, and it's true that in some cases 2 is better than 0, the idea is that twin pregnancies are not completely free of risks. Risks that include preterm labor, higher risk of developing eclampsias or hypertension or gestational diabetes. It could happen that one of the babies grow well and the other have problems, and then you may have to take tough decisions because what is going to be good for one of the babies is not going to be good for the other. And of course, unfortunately, every so often we have patients that may have their babies at 29 or 30 weeks, babies that weigh 900 grams and that are not free of having severe complications. Another important aspect to take into account when you request transferring more than one embryo is that the embryos, when transferred together, they don't disturb or they don't help each other. They are completely independent beings, in the sense that if we transfer 2 embryos and you get twins, if these embryos had been transferred in 2 different cycles, you probably had got 2 different pregnancies. So when you transfer more than 1 embryo, you may be saving time because you are going to need fewer transfers. You may be saving money as well, of course, because each transfer has a cost, but you are not going to increase the overall pregnancy rate of the cycle. This is that if you do an IVF and you end up with 4 embryos, these embryos could offer you, let's say, an 85% success rate with any of them, not the first, probably the first, the second, or the third one. That 85% is going to be exactly the same if you transfer 4 times 1 embryo or if you transfer twice 2 embryos. You are going to need fewer treatments to reach that 85%, but the overall pregnancy rate of the cycle is not going to change. So from the medical point of view, in terms of success rate and in terms of safety for the babies, there is no medical reason to transfer more than 1 embryo together, only reasons related to time or money.